My wife did not remove our son from intensive care because another child was sicker. If that had been the reason, I might have forgiven her. She removed him because the other child belonged to the man she used to love. At 2:17 in the morning, I woke to the sound of wheels moving outside room 8 of the pediatric intensive care unit. For a second, I thought it was another crash cart. Our 13-year-old son, Caleb, had been asleep for less than an hour. 2 days earlier, a pickup truck had run a red light and hit the passenger side of my SUV. I walked away with bruised ribs. Caleb did not. 3 fractured ribs. A grade 3 splenic injury. A small pulmonary contusion. And the part that scared me most, a tiny bleed along the left side of his brain that neurosurgery said appeared stable on repeat imaging. Stable. That word had become my entire religion. Stable oxygen. Stable hemoglobin. Stable CT. Stable neurological exam. He had not needed surgery. But the pediatric intensivist wanted him monitored another night because his oxygen saturation had dipped twice while sleeping and his hemoglobin had dropped enough that nobody wanted to pretend the spleen was finished making trouble. So when 2 nurses entered with a portable monitor and began disconnecting equipment, I sat up immediately. What's happening? Nurse Hannah Pierce froze. She knew me by then. Every parent in an ICU becomes a little unbearable after 48 hours. I had earned my badge honestly. Mr. Mercer, why are you moving him? She looked toward the doorway. That was when I saw my wife. Dr. Vivian Mercer. Trauma surgeon. Director of Acute Care Surgery at St. Catherine Children's and Regional Medical Center. My wife of 16 years. Caleb's mother. Still wearing navy scrubs beneath a white coat. Her hair pulled into the same severe knot she wore whenever she was trying to look more like a physician than a person. Daniel, she said quietly. I stood. No. I haven't said anything yet. You're moving him. He's being transferred to step down. No. Her jaw tightened. His repeat CT is unchanged. Dr. Shah said he wanted one more night. His respiratory status is improved. Dr. Shah said one more night. Daniel. Where is Dr. Shah? He's with another patient. Then nobody touches Caleb until he comes in here. Nurse Pierce stopped moving. Good. Vivian looked at her. Continue the transfer. The nurse hesitated. That was the first moment I understood this was not routine. Hannah. Vivian's voice sharpened. Room 8 has been cleared for downgrade. Pierce looked miserable. Dr. Mercer, PICU attending note still says reassess at morning rounds. I spoke with bed management. That sentence hit me strangely. Not medical judgment. Bed management. Why does the hospital need this bed? Vivian did not answer. I stared at her. Who is coming in? Daniel, don't do this here. My stomach went cold. That phrase. Not now. Not here. Usually it meant the answer was worse than the question. Who needs Caleb's bed? She glanced toward the hallway. Too late. I walked past her. 2 rooms down, a trauma team was gathering near the elevator. Respiratory therapist. PICU fellow. Blood cooler. Portable ventilator. And standing beside the wall with blood on the front of his shirt was Eric Dalton. Vivian's ex-husband. I stopped. Eric saw me. His face changed. Daniel. I barely heard him. On the stretcher coming off the elevator was a boy. Maybe 11. Pale. Intubated. Bandages around his abdomen. Eric's son, Lucas. I knew him. Not well. Birthday photographs online. One awkward hospital charity picnic. The child had nothing to do with the history between the adults around him. He looked critically ill. That mattered. I turned toward Vivian. What happened? Her expression changed from command to something closer to fear. ATV rollover. How bad? Liver injury. Emergency operation at County North. Why is he here? They don't have pediatric critical care surgery overnight. And St. Catherine does. Yes. I looked toward Lucas again. Does he need PICU? Yes. No hesitation. More than Caleb? Vivian finally looked away. That was the answer I did not want. Clinically? Daniel. Clinically. She inhaled. Lucas is intubated after damage control surgery. He needs a PICU bed. That wasn't my question. Caleb can safely move to intermediate care. According to who? Me. You're not his intensivist. I'm a trauma surgeon. You're also his mother. Her eyes flashed. And Lucas is crashing. That was true. I could see it. His blood pressure was low enough that the nurse at the stretcher kept looking at the monitor. A bag of blood hung above him. He needed intensive care. Maybe immediately. But hospitals did not normally solve that by letting one parent doctor personally downgrade her own child against the documented plan. What are the other options? Vivian went silent. Other PICU beds? Full. Adult ICU? Not appropriate. PACU overflow? Being used. Transfer Lucas? Closest pediatric center accepting critical trauma is 90 minutes. Then what did the intensivist recommend? Her eyes moved again. That was when I knew. He didn't recommend moving Caleb. She did not answer. Vivian. Dr. Shaw said Caleb could probably tolerate step down if absolutely necessary. Probably. Absolutely necessary. 2 phrases doing enormous work. And did he sign the transfer? No. Why not? He was in a code. Then you decided. Yes. Eric stepped toward us. Daniel, Lucas is dying. I turned to him. This is not your fault. He stopped. I meant it. The child needed a bed. Eric had every right to fight for his son. But Vivian had a different responsibility. She was not just another desperate parent. She had institutional authority. Enough to make nurses move before the physician responsible for Caleb had changed his plan. I looked at her. Did you tell bed management Caleb is your son? Yes. Did you tell them Lucas is Eric's? A pause. No. That silence was worse than if she had said yes. Why? It wasn't relevant. I laughed. Actually laughed. Not because anything was funny. Your ex-husband's son needs the bed currently occupied by your son, and you personally intervene to free it. Because Lucas needs ICU-level care. And you didn't think the relationship was relevant? I made a clinical decision. No. My voice stayed low. You made a decision inside a conflict you should never have been controlling. Her face hardened. You want me to let a child deteriorate in an emergency department because you're jealous? There it was. The escape route. Jealousy. Make me small enough and she would not have to answer the real question. I stepped closer. Do not do that. Then stop making this about Eric. You made it about Eric the second you hid the relationship from bed management. Pierce was still standing in Caleb's room. Listening. So were 2 residents. This had become public. I hated that. Vivian lowered her voice. Caleb is stable. For now. Yes. His hemoglobin dropped again at midnight. By 0.6. His oxygen dipped to 88 twice. While asleep. He still has a pulmonary contusion. I know my son's injuries. Then act like his mother. Her face went white. That was cruel. I knew it when I said it. But cruelty and truth sometimes arrive holding the same sentence. Vivian whispered. I am trying to save both children. Then bring in someone without our last name to decide which child moves. That should have been obvious. It was not. Not to her. Not in that moment. Because Vivian had spent 20 years becoming the person people called when a room needed a decision. She was good at it. Excellent, actually. One of the reasons I loved her. But somewhere along the way, she had started believing that being capable of making a decision meant she was always the right person to make it. Even when the decision involved her own child. Even when the beneficiary was her ex-husband's. I went back into Caleb's room. He stirred. Dad? I immediately softened. Hey. Why are they moving stuff? No one's doing anything yet. He blinked at Vivian behind me. Mom? She came in. For 1 second, every title disappeared. No surgeon. No director. Just his mother. She touched his hair. Buddy, another kid came in who's really sick. Caleb looked toward the hall. Am I okay? Vivian hesitated. That was not what a 13-year-old needed. I answered. You're doing better. He looked at the monitors. Then at her. Does he need this room? Vivian's eyes filled. Yes. Caleb was quiet. Then he said. He can have it. I closed my eyes. Of course he did. He was my son. Kind enough to volunteer the thing the adults should have protected him from having to decide. Vivian kissed his forehead. Thank you. Something inside me snapped. No. She looked at me. What? You do not thank him for giving away his ICU bed. Daniel. He's 13. He offered. Because you explained another child might die. I didn't say that. He can see the ventilator. Caleb looked between us. Dad, it's fine. I turned to him. No, buddy. This isn't your problem. Then Dr. Ravi Shah walked into the room. Piku attending. Still wearing gloves from whatever emergency had pulled him away. He looked at the disconnected leads. Then at Vivian. What's going on? Nobody answered fast enough. He walked to the chart. Why is room 8 transferring? Vivian said. Lucas Dalton needs the bed. I know. Shah looked at Caleb's monitor. I did not clear this transfer. He's stable enough for intermediate care. I said potentially. His voice changed. Not loud. Dangerously calm. I said if we had no alternative after reassessment. We don't have an alternative. We have an emergency ICU overflow protocol. PACU is occupied. Then we activate temporary one-to-one critical nursing in recovery while we move another appropriate patient. That takes time. Yes. Lucas may not have time. Shah looked toward the hall. Then back at Vivian. I understand. He did. That was the difference. Understanding urgency did not make process disappear. He asked. Did you make this transfer order? Yes. You're not PICU's service. I have admitting privileges. For your surgical patients. Caleb is trauma. He is not your patient. The room went silent. Our son was in the bed between them. Vivian seemed to realize how this looked only after Shah said it plainly. He continued. And you're his mother. Then. Who is Lucas Dalton to you? Her face tightened. Former stepson. Not exactly. She had never been Lucas's stepmother. Eric had remarried after their divorce. But I understood why she said it that way. Emotional shorthand. Shah's expression changed. You need to step out. Ravi. Now. I had never heard anyone speak to Vivian like that in her hospital. She stood frozen. Then Shah turned to Nurse Pierce. Reconnect everything. Caleb remains PICU until reassessment. Call nursing supervisor. Activate overflow. Tell trauma I want Lucas stabilized in PACU with PICU coverage until we create capacity. Pierce moved instantly. Vivian stared at Shah. You're delaying definitive critical care. No. I'm preventing a conflicted physician from moving one child to make room for another. That sentence would later appear in 3 separate reports. At the time, it just destroyed whatever remained of the room. Eric came in from the hall. Vivian. She turned. They're keeping Caleb here. His face collapsed. What about Lucas? Shah answered before she could. We are taking him. Where? Recovery temporarily. PICU nurse, respiratory, intensivist coverage. He will receive ICU-level care. Is that safe? It is the safest available bridge until we create a bed. Eric nodded. He did not argue. He did not demand my son be removed. That mattered. This was not Eric stealing anything. Vivian had done that on her own. Lucas went to recovery. 27 minutes later, another PICU patient was transferred safely to the pediatric floor after the attending completed a planned morning downgrade early. Lucas received the bed. No child was abandoned. No one had to choose between them after all. That should have ended the crisis. It didn't. At 4:03 a.m., Caleb's heart rate climbed. At 4:09, his blood pressure dropped. At 4:12, he said his stomach hurt worse. Dr. Shah ordered labs. His hemoglobin had fallen sharply. The splenic bleed had progressed. Within 15 minutes, interventional radiology was being called for embolization. I looked at Vivian. She looked like someone had been punched. If Caleb had been moved to step down, he still might have been caught. Intermediate care was not an unmonitored hallway. But the response would have been different. Fewer nurses. Different staffing ratios. No intensivist 10 feet away. Maybe the delay would have been 5 minutes. Maybe 15. Maybe none. We would never know. That uncertainty was enough. Vivian approached his bed. I stepped between them. Don't. Her face broke. He's my son. Yes. I need to be with him. No. Daniel. You need to leave this unit. You don't get to keep me from my child. Not as his mother. I pointed toward her white coat. But right now, nobody in this room knows which version of you is making decisions. That stopped her. So did Shah. Vivian. He stood behind me. You should step away. She looked at both of us. Then at Caleb. She removed her white coat. Folded it over the chair. And sat beside our son. Just his mother. For the first time that night, Caleb went to interventional radiology at 5:11. The embolization worked. By 7, his blood pressure stabilized. By 8, his hemoglobin stopped falling. By 9, he was awake enough to complain about being thirsty. Best complaint I had ever heard. Vivian stood beside his bed. I stood on the other side. Neither of us spoke about what happened. Not yet. Then at 9:34, a hospital administrator entered. Dr. Margaret Lynn, Chief Medical Officer. Behind her stood the Vice President of Nursing and someone from compliance. Vivian saw them and closed her eyes. "Vivian," Dr. Lynn said, "I need your badge." Caleb looked confused. "Why?" I hated that he was awake for this. Vivian kept her voice calm. "It's okay." Dr. Lynn continued. "Effective immediately, you're being placed on administrative leave from clinical leadership duties pending review of an overnight patient placement incident. Not fired. Not stripped of her medical license. Not even removed from surgery permanently. Not yet. Just leave. Appropriate." Vivian unclipped her badge. Then Lynn added, "Your surgical privileges remain subject to emergency suspension review. Until that review is complete, you may not provide patient care at St. Catherine." That landed harder. Vivian looked at me. For once, I did not feel victorious. Our son had nearly bled into shock. Her ex-husband's child was still intubated down the hall. And our marriage was sitting between 2 ICU beds nobody should ever have made personal. Vivian handed over the badge. Dr. Lynn left. Caleb whispered, "Mom, are you in trouble?" Vivian looked at him. Then said the one thing she should have said hours earlier. "Yes." No excuse. No explanation. Just yes. I reached for Caleb's hand. His fingers closed around mine. Then Vivian asked, "Daniel, can we talk outside?" "No." Her face changed. "Later?" "No." She stared at me. "What does that mean?" It meant I was finished letting the hospital, our marriage, and Eric Dalton occupy the same room. It meant Caleb was not staying one more day in a place where his mother's authority could become part of his care. It meant I had spent the night watching a surgeon I respected more than almost anyone decide that our son was the safest person to displace because she believed he would probably be fine. I looked at Dr. Shaw. "When he is medically stable for transfer, I want him moved." Vivian went still. "Moved where?" "Children's National Lakeside. That's 2 hours away. They have a pediatric trauma service. So does this hospital." "I know. I work here." "Not anymore." Her face collapsed. Temporarily, I reminded myself. But I did not correct the sentence. "Not then." She whispered, "You're taking him away from me." "No." I looked at our son sleeping between us. "I'm taking him out of a system where you forgot being his mother should have made you step back, not step over everyone else." She started crying. I had almost never seen Vivian cry. Not in an operating room. Not at funerals. Not when her father died. Now she could barely breathe. "Daniel, please." I did not answer. Because there were still medical decisions to make. Transfer approval. Transport timing. Insurance. Specialist handoff. No dramatic kidnapping. No father marching out with a child against medical advice. I would wait until Caleb was stable. I would do it correctly. Then I would take my son somewhere his mother was only allowed to be his mother. And as Vivian stood beside the PICU bed with her hospital badge gone from her coat, neither of us yet understood how much that one decision would cost her. Not just the directorship. Not just the privileges. By the time St. Catherine finished reviewing why Dr. Vivian Mercer had personally tried to remove her own injured son from intensive care to make room for her ex-husband's child, she was going to discover that losing everything had very little to do with one hospital job. Caleb was stable enough to transfer 31 hours later. Not discharged. Not recovered. Transferred. That distinction mattered because Vivian acted like I was taking him home in the middle of a hemorrhage. You don't move a child 48 hours after embolization unless there's a medical reason. There is. What? I don't trust this hospital with you inside his chart. Her face changed. We were standing outside Caleb's room while the transport team reviewed paperwork with Dr. Shaw. Vivian had returned in civilian clothes. No white coat. No badge. Administrative leave meant exactly that. She could visit as Caleb's mother. She could not enter orders. Could not direct nurses. Could not open his record using physician access. Could not turn a family conversation into a clinical instruction. That boundary had transformed her overnight. She hated it. I could tell. But she had followed it. So far. Daniel, she said quietly, my access has been suspended. I know. I physically cannot alter his orders. This isn't only about what you can do today. Then what is it about? The fact that yesterday you believed you should. She looked toward the room. Caleb was watching baseball highlights on a tablet, one hand wrapped around a cup of ice chips. He already looked better. That made everything emotionally more confusing. When your child improves, it becomes tempting to downgrade the decision that endangered him. See? He's fine. No harm. Move on. I was not going to do that. Vivian folded her arms. Lakeside called me this morning. I stared at her. Why? Dr. Kessler knows me. Of course he did. Vivian knew surgeons everywhere. What did he want? He asked whether this transfer was medically necessary. My anger rose. What did you say? The truth. Which version? Her face tightened. That Caleb is stable, his embolization succeeded, and St. Catherine is capable of continuing his care. So you tried to stop it? No. You called the receiving hospital. He called me. And you discussed whether they should accept our son. I discussed his medical condition. You are suspended from his care. I am still his mother and a surgeon. There. What? That sentence. She stared at me. You still think being a surgeon gives you a larger vote as his mother. That is not what I said. It's exactly what you said. Before she could answer, Dr. Shaw stepped into the hall. Both of you. We stopped. He looked at Vivian first. Did you communicate with Lakeside's trauma service? Yes. About Caleb? Yes. His expression hardened. Do not do that again. Vivian went pale. Ravi, David Kessler called me. Then tell him you are not participating in medical decision-making. I didn't give orders. That is not the standard. His voice remained calm. You are under administrative restriction involving a conflict in this patient's care. Informal physician-to-physician conversations can influence transfer decisions whether you intend them to or not. Vivian looked humiliated. For a surgeon who built her identity around being the most medically credible person in a room, being told her expertise itself had become part of the problem was almost unbearable. She nodded. Understood. Shaw turned to me. Lakeside accepted Caleb. My shoulders loosened. Transport? Pediatric critical care transport, although he no longer requires ICU-level support. It is the safest way to move him given recent embolization. Okay. He'll go to their trauma step-down service. Not ICU? No. I paused. That mattered too. If I insisted on an ICU bed he no longer needed simply because of what happened here, I would be doing my own version of what Vivian had done. Turning fear into resource allocation. Step-down is fine. Shaw nodded. Good. Vivian looked at him. Ravi, do you agree with the transfer? He considered his answer carefully. Medically, he can remain here. My chest tightened. Then. But the family has lost confidence in the care environment, and Lakeside can provide equivalent follow-up. Given the circumstances, transfer is reasonable. Not necessary. Reasonable. That was enough. At 2:08 p.m., Caleb left St. Catherine. No dramatic wheelchair escape. No reporters. 2 transport nurses moved him onto the stretcher. He complained about the straps. Good sign. Vivian walked beside him to the ambulance bay. When the back doors opened, Caleb looked at her. You're coming? She froze. I had not thought about that part. Neither had she. The ambulance could take one parent. I was going. That had been assumed. Caleb looked between us. Vivian forced a smile. Dad's going with you. I'll drive. He nodded. Okay. Then. Mom? Yes? Is Lucas okay? Her face changed. He's still sick. Is he awake? Not yet. Did he get my room? I closed my eyes. Vivian did too. Yes. Caleb thought about that. Then said. Good. No resentment. No accusation. Nothing about being displaced. Just relief that another kid had gotten care. Vivian touched his hand. Caleb. Mom, it's okay. No. It wasn't. But I understood why he wanted it to be. Children hate being the reason adults destroy each other. The ambulance doors closed. Vivian stood alone in the bay while we pulled away. At Lakeside, things became boring. Exactly what I wanted. New attending. New trauma team. Repeat labs. Pain control. Pulmonary exercises. Physical therapy. No one knew Vivian except professionally. No one cared about Eric. No one knew the story until the transfer summary required explanation of why certain records were restricted. Caleb spent 4 more days there. He improved every day. Vivian visited twice. She asked before coming. That was new. The first time, she sat beside him for 3 hours and did not once ask the nurse what his hemoglobin was. I noticed the effort. So did she. At one point Caleb asked, "Mom, what's my number?" "What number?" "My blood thing." "Hemoglobin?" "Yeah." Vivian looked toward me. "Not the chart." "Me." I answered. 10.2 this morning. She nodded. "Good." That one tiny exchange told me she was finally trying to separate mother from doctor. Then Lucas woke up. Eric texted me himself. I did not know how he got my number. Probably Vivian. Lucas is extubated. He's talking. "I wanted you to know." I stared at the screen. Then replied. "I'm glad." A minute later. "I'm sorry about what happened with Caleb. I didn't ask Vivian to move him. I believed him." I wrote. "I know." Then Eric sent something I did not expect. She told me before we arrived that she could make room. I thought that meant hospital capacity, not Caleb. I read it twice. That changed the timeline. Vivian had known before Lucas arrived. She had already decided our son might be the bed she freed. I did not answer Eric. Not yet. I called Vivian. She was at home. I could hear the dishwasher. Ordinary domestic noise around a conversation that was about to become anything but ordinary. "Did you tell Eric you could make room before Lucas reached St. Catherine?" Silence. There it was again. The silence that told me the answer. Yes. My stomach dropped. When? During the transfer call. How long before they arrived? Maybe 40 minutes. So before you came to Caleb's room? Yes. You had already decided. No. Vivian. I had identified him as one of the possible step-down candidates. Our son. Yes. Who else? She stopped. That question mattered. Who else? 2 other children. Were either of them actually moved? No. Why Caleb? Another silence. Because he was the strongest candidate clinically. According to who? His trajectory. Who evaluated the 3? I did. There it was. Again. Not PICU leadership. Not bed management alone. Vivian. Did you tell Shah you were comparing them? No. Did you tell bed management you were Lucas's former family connection? No. Did you tell them Caleb was your son? Yes. That inconsistency was almost surreal. So you disclosed the conflict on one side and hid it on the other. I didn't think Eric mattered. You told him you could make room. Yes. You knew Lucas personally. Yes. You cared about him. Yes. Then Eric mattered. She started crying. I know. I sat down. This was not getting simpler with distance. It was getting worse. Not because Vivian had chosen Lucas over Caleb in some cartoon sense. The clinical part remained plausible. Caleb really had been improving. Lucas really was critically ill. There really was no open PICU bed. The problem was that Vivian had inserted herself into a triage decision where she had 2 personal relationships on opposite sides. Then acted as though her expertise neutralized the conflict. Did hospital investigators ask you about that call? Yes. What did you tell them? Everything. Good. At least that. She did not defend herself. Then. Daniel, I need to tell you something else. I closed my eyes. What? Eric asked for me specifically. For Lucas? Yes. He requested you as surgeon? Yes. Did you operate? No. Why not? I was not on call. That was something. Did you try? Silence. Vivian. I asked the on-call trauma surgeon if he wanted me involved. And? He said no. Who? Dr. Chen. Why? He knew Lucas was Eric's son. Of course. Dr. Chen had seen the conflict immediately. The person who missed it was Vivian. What did you do? I stepped out of the operation. So you understood you shouldn't operate on Lucas? Yes. But you thought you should decide which child gave him an ICU bed. Her breathing broke. I know how insane that sounds now. It doesn't sound insane. That was important. It sounds like someone who thought conflict only mattered when she held the scalpel. Silence. Then. Yes. That was exactly it. Vivian had a sophisticated understanding of surgical ethics. She knew better than to operate on someone tied closely to her personal life when another qualified surgeon was available. But bed allocation felt administrative. Operational. Something below the threshold where she thought recusal applied. Yet the decision had been just as consequential. Maybe more. St. Catherine's review expanded the next day. Not criminal. Not a medical board case yet. Hospital credentialing. Peer review. Compliance. Patient safety. The chief medical officer notified Vivian that investigators were examining whether she had interfered with ICU placement outside her assigned clinical role, failed to disclose a relevant personal conflict, attempted to influence transfer of a patient for whom she was a parent, and later contacted the receiving hospital while under administrative restriction. That last one was mine. My transfer. She had made it worse again. The hospital extended her suspension. Her directorship duties were reassigned indefinitely. Her surgical privileges remained inactive pending medical executive committee review. Then the second consequence landed. Vivian's malpractice carrier contacted her. Not because Caleb had sued. I had not. Because St. Catherine had reported a potential professional conduct event affecting risk status. No cancellation. No dramatic insurance collapse. Just notice that coverage terms might be reviewed if privileges were restricted. She called me immediately. I could lose my practice. You don't have a private practice. You know what I mean. Her entire surgical career. Not from one letter. If St. Catherine revokes privileges, every credentialing application asks about it. That was true. Then cooperate. I am. Fully. Yes. No edited version? No. She sounded exhausted. Then. Do you want me to lose my license? The question angered me. No. She sounded surprised. Why not? Because this isn't revenge. You're taking Caleb away. I transferred him. You're talking to a lawyer. I went still. How do you know? Bank alert. Of course. I had paid a family law attorney from our joint account. Not hidden. Still. Yes. You're filing. I'm getting advice. About divorce? And medical decision-making. Her voice broke. You want sole custody. I want to understand my options. Daniel, he's 13. I know. He needs both of us. Yes. That answer stopped her. I am not trying to erase you as his mother. Then what? I am trying to make sure you cannot use physician authority inside his care again without someone else controlling the decision. Silence. That was different from custody as punishment. My lawyer had already explained that courts do not casually remove a parent because of one professional lapse. Nor should they. But legal decision-making around healthcare could be structured. Neutral treating physicians. No unilateral physician-parent orders. Possibly primary medical authority with one parent if conflict became severe. I did not yet know what I wanted. Only what I never wanted again. Vivian whispered. What does Caleb want? That was the hardest question. He wants to go home. With who? I did not answer. Because Caleb had already told me. At Lakeside, that morning, he had asked. When I get discharged, can I stay with you at Uncle Mark's? Not home. Not Mom. Me. My brother's house. He had not sounded angry. He had sounded scared. What did he say? Vivian asked. I closed my eyes. He wants to stay with me for a while. Nothing on the line. Then a broken breath. Did he say why? Yes. I hated this part. He said he doesn't want to wake up and hear people discussing whether he's sick enough to keep his bed. Vivian started sobbing. I did not comfort her. Not because I wanted her to hurt. Because this was Caleb's fear. Not mine to soften before she heard it. When she could speak again, she asked. Does he hate me? No. You're sure? Yes. How? Because he keeps asking whether you're eating. That broke her harder. Caleb loved his mother. That did not mean he felt safe letting her be his doctor. The hospital had learned that distinction overnight. Now our family would have to learn it too. 2 days later, Caleb was discharged from Lakeside. He came home with me. Not to our house. To my brother Mark's place across town. Temporary. Legally uncomplicated because Vivian agreed. That surprised everyone, including her attorney. She signed a written temporary parenting arrangement giving me primary physical care during Caleb's recovery while she had scheduled visits and full access to his treating physicians as a parent, but explicitly not as a treating physician. Her idea. Not mine. At the bottom, she had added one sentence through counsel. Dr. Vivian Mercer shall not issue, alter, recommend, or facilitate clinical orders for Caleb Mercer except in an immediate emergency when no treating professional is available. When my lawyer read it, he looked at me. She understands the problem. Yes. Does that change your marriage decision? No. Not yet. Understanding after harm matters. It does not erase the harm. That same afternoon, St. Catherine scheduled Vivian's medical executive committee hearing. Not a public trial. Not a criminal proceeding. A credentialing review that could decide whether she returned to surgery, returned with restrictions, or lost hospital privileges entirely. And for the first time in her 20-year medical career, Vivian Mercer would sit in a room where being the best surgeon at the table would not give her the right to control the outcome. Vivian's credentialing hearing lasted 3 hours and 46 minutes. She spent the first 37 explaining medicine. That was her mistake. The medical executive committee met in a windowless conference room on the 9th floor of St. Catherine. 9 voting physicians. Chief Medical Officer Margaret Lynn. Chief Nursing Officer. A representative from Risk Management. Vivian. Her attorney. And an outside physician reviewer the hospital had brought in from Milwaukee because half the surgeons in St. Catherine had either trained under Vivian, worked for her, or owed her favors. I was not there. Neither was Eric. Neither was Caleb. The hospital had our written statements. That was enough. Vivian told me about the hearing afterward. More accurately, she gave me permission to read the relevant portions of the summary because Caleb's case was part of it. The committee chairman began with a simple question. Dr. Mercer, was Caleb clinically eligible for step-down care at 2 a.m.? Vivian answered like the surgeon she was. She discussed his unchanged head CT, improving oxygenation, hemodynamic stability, serial abdominal exams, expected monitoring capacity in pediatric intermediate care. She cited literature, staffing ratios, criteria. Then the outside reviewer interrupted. Doctor, nobody asked whether transfer was medically imaginable. Vivian stopped. He continued. We asked whether the transfer should have been initiated by you. That shifted the room. Vivian answered. No. Why not? Because I was his mother. And? Because Lucas Dalton had a personal connection to me. What connection? He was the son of my former husband. Did you have a current relationship with the child? Yes. How significant? Vivian hesitated. That mattered. She had spent years attending some of Lucas's school events when Eric asked. Sent birthday gifts. Helped when he broke his wrist at 9. Had him at our house twice when Eric had travel emergencies. Not a mother. Not a stranger. The reviewer asked. So you had a personal interest in both patients? Yes. Opposing interests? Yes. And you inserted yourself into allocation of a scarce critical care resource between them? Yes. No medical explanation could fix that sentence. Then Margaret Lynn asked. Why didn't you call me? Vivian looked confused. The CMO? Yes. It was after 2 in the morning. I was on call administratively. Vivian said nothing. Lynn continued. Why not call the house supervisor? I spoke to bed management. Why not ask Dr. Shah to identify the safest downgrade? He was occupied. Why not ask the PICU fellow? I thought I had enough information. There. That phrase. Enough information. The committee kept returning to it. Not. Was Caleb stable? Not. Was Lucas sick? But. Why did Vivian keep assuming she personally had enough information to substitute for independent judgment? The outside reviewer asked. Were there 3 possible PICU patients who might have been downgraded? Yes. Did you have complete information on all 3? Enough to compare them? Were you there attending? No. Were you credentialed to make PICU disposition decisions for them? Not independently. Then why were you comparing them? Vivian tried to answer. She couldn't. Not convincingly. Eventually she said. Because Lucas was coming. The reviewer nodded. Exactly. That became one of the committee's central findings. The incoming patient did not merely create urgency. His identity created urgency specifically for Vivian. She had acted because Lucas was coming, not simply because a critically ill child was arriving. Then the committee brought in Dr. Mei Chen, the trauma surgeon who had operated on Lucas. She appeared remotely. The chairman asked, "When Dr. Mercer requested involvement in Lucas Dalton's surgery, why did you decline?" Chen answered, "Because I knew the family relationship." Would Dr. Mercer have been clinically qualified? Absolutely. More qualified than you? Chen smiled faintly. She'll enjoy hearing me say this. In complex pediatric trauma, probably. A few people laughed. Vivian did not. Chen continued. But the question wasn't whether she could operate. It was whether she should. That distinction was becoming the entire case. What did Dr. Mercer do after you declined? She stepped away. Any interference? No. Any attempt to overrule you? No. Any criticism afterward? No. That helped Vivian. She had recognized the surgical conflict. She had respected another physician's boundary. This was not a doctor incapable of ethics. It was a doctor who had drawn the ethical line around the operating room and nowhere else. Then Nurse Hannah Pierce testified. Her statement was more damaging. She described Vivian ordering her to continue disconnecting Caleb after I objected. The committee asked, "Did you believe you could refuse?" Pierce hesitated. "I knew technically Dr. Mercer wasn't my direct supervisor in PICU. Technically, she was director of acute care surgery. And Caleb's mother. Yes. And a highly senior physician in the hospital. Yes. What did that mean to you in the moment?" Pierce answered, "That if I challenged her and she turned out to be right, I might have trouble afterward." Vivian later told me that was the moment she stopped taking notes. The problem had expanded again. She had not threatened Pierce. Had not said, "Move him or your job suffers." But authority does not always need to announce itself. Sometimes everyone in the room already knows who can make life difficult. Margaret Lynn asked Pierce, "Did Dr. Mercer normally direct PICU nurses?" "No." "Then why did you begin the transfer?" "Because she said bed management had cleared it and she spoke like the decision had already been made." That phrase hurt. Like the decision had already been made. Vivian had built a career on sounding certain when everyone else was panicking. In trauma surgery, that saved lives. In a conflicted bed placement decision, it made people stop asking whether she belonged in the decision at all. Then came the question of my transfer to Lakeside. Dr. David Kessler testified that he had called Vivian because he knew her professionally and wanted context. He admitted that was his mistake too. The committee chairman asked, "Did Dr. Mercer ask you to refuse the transfer?" "No." "Did she discourage acceptance?" Kessler paused. "She emphasized that St. Catherine remained medically capable." "Did that influence you?" "For several minutes, yes." "Would it have influenced you differently if she had identified herself only as the patient's mother under administrative restriction?" "Yes." Vivian closed her eyes when she read that answer. Again, she had not issued an order. She had not lied. She had simply entered a conversation where her professional identity carried weight she was no longer supposed to use. The committee recessed. 42 minutes. When they returned, they separated the outcome into 4 parts. That mattered. Hospitals do not have one giant switch-marked career. First, the committee found no evidence Vivian intentionally endangered Caleb. No evidence she believed step-down care was medically unsafe. No evidence she tried to harm our son for Eric or Lucas. That language mattered to me. Because anger had occasionally tempted me toward the ugliest possible interpretation. The record did not support it. Second, the committee found she had an unmanaged dual personal conflict and should have recused immediately from all bed allocation decisions involving Caleb and Lucas. Third, she had improperly exercised professional influence outside her assigned clinical role, including directing nursing activity before PICU approval and contacting the receiving physician during administrative restriction. Fourth, her conduct reflected a leadership failure more than a technical surgical failure. Then came the consequences. Vivian permanently lost her position as director of acute care surgery. Not suspended. Gone. She would no longer supervise the trauma service. No committee chair. No department budget. No hiring authority. No leadership stipend. That alone cut a significant portion of her income. Her surgical privileges were not revoked. Instead, they were reinstated after 60 days under conditions. For 1 year, She could not participate in the care of immediate family members except in a true emergency where no alternative physician was available. Any treatment of a patient with whom she had a significant personal relationship required disclosure and secondary physician review when feasible. She had to complete professional boundary remediation. For 6 months, a senior surgeon would review selected cases involving non-operative disposition decisions. No restriction on her ability to operate generally. No finding that her surgical judgment was technically deficient. Vivian could still be a surgeon. She just could not be the surgeon who ran everyone else. When she told me, she sounded hollow. They took the department. I was standing in Mark's kitchen while Caleb did homework at the table. Yes. 20 years. You weren't director 20 years. You know what I mean. I did. She had built that trauma program for 7. Recruited surgeons. Expanded coverage. Created a regional transfer network. Reduced emergency operative delays. The directorship mattered to her because she had earned it through real work. Losing it hurt precisely because the rest of her career had value. Are you appealing? My attorney says I could challenge the permanent leadership removal. On what basis? Proportionality. Do you think it was disproportionate? Silence. I don't know. That was becoming her most honest phrase. Then. I keep thinking nobody was harmed by the transfer because it never happened. I looked toward Caleb. His textbook was open. He was tapping a pencil against his lip. Alive. Healing. Caleb was harmed. Vivian went quiet. Not physically by the move. No. But he's afraid of hospitals now. Her breathing changed. I continued. He asked the lakeside nurse 3 times whether somebody could take his room if a sicker kid came in. Nothing from Vivian. He asked me if his monitor would stay connected while he slept. She started crying. That was harm. Not the kind malpractice damages measure easily. Not a surgical complication. Trust. A 13-year-old had learned that medical stability could become something adults negotiated around him. Vivian whispered. I did that. Yes. I was trying to save Lucas. I know. That sentence surprised her. You believe me? I always believed that. Then why does it feel like you think I chose Eric? Because you keep making Eric the question. Silence. The problem isn't that you cared about Lucas. I lowered my voice. The problem is you decided caring gave you authority. That was different. And worse. The hospital communicated the leadership change internally the next day. No patient details. Dr. Vivian Mercer would return to clinical practice after temporary suspension but would no longer serve as director of acute care surgery. Rumors exploded anyway. Some said she had nearly killed Caleb. False. Some said she stole an ICU bed for a lover's child. False twice. Eric was not her lover. Lucas had legitimately needed intensive care. Others defended her too aggressively. One surgeon posted in a private physician group that St. Catherine had sacrificed its best trauma surgeon to appease an angry husband. That leaked. I hated it. So did Vivian. She called the surgeon herself. Take it down. Vivian, I'm defending you. No. Everyone knows this is because Daniel complained. No. Apparently the surgeon argued. Vivian interrupted. My husband did not make me order a transfer. Good. He did not hide my conflict. Good. He did not contact Lakeside as a physician after I was restricted. Even better. The post disappeared within an hour. Then something happened I had not expected. Eric came to see me. Not at Mark's house. I would not have allowed that. We met at a coffee shop near Lakeside after one of Caleb's follow-up appointments. Lucas had been discharged. Still recovering. Likely full recovery. Best outcome possible. Eric sat across from me. I owe you an apology. You didn't move Caleb. No. You didn't ask her to. No. Then for what? He looked uncomfortable. I called Vivian before I called the transfer center. My jaw tightened. Why? Because I knew she could get things done. There it was. A familiar human weakness. Not evil. Shortcut. County North said St. Catherine was full. So you called your ex-wife? Yes. What did you ask? I told her Lucas needed somewhere better. And? I said, please find him a bed. I stared at him. Did you know Caleb was in PICU? Yes. That changed my expression. Eric raised both hands. I did not ask for his. But you knew. Yes. And you still called her. My son had just come out of emergency surgery. That was the one explanation I could not dismiss. If Caleb had been dying in another hospital, I would have called everyone I knew. Used every connection. Begged. Demanded. Maybe worse. Eric continued. I thought Vivian would call administration. She did more. I know. Did you ever think your history with her would affect how hard she pushed? His answer took too long. Yes. There it was. Not conspiracy. Not affair. He had known she might move faster because it was him. And his son. Why tell me now? Because everyone is blaming her like she acted in a vacuum. She made the decision. Yes. I called the person I knew would have trouble saying no. That line stayed with me. Eric knew something about Vivian I had learned in a different context. She could say no to strangers. Residents. Administrators. Insurance companies. But people tied to her history? That was harder. Especially when saying yes let her become useful. Needed. The surgeon who fixed the impossible problem. I asked. Are you going to tell the hospital? Already did. Good. His statement did not excuse Vivian. It clarified the pressure. That mattered. Before he left, Eric asked. Does Caleb hate Lucas? No. Lucas thinks he stole his bed. My chest tightened. He didn't. I know. Tell him that. I have. Tell him again. Eric nodded. 2 children carrying guilt created by adults who should have known better. That was the part one hated most. That evening, I told Caleb Lucas was home. He smiled. Can I text him? I was surprised. You have his number? No. Then how are you planning to text him? Mom has it. Of course. I looked at him. You want her to send it? He shrugged. Yeah. That was the first thing he had asked from Vivian since discharge. I called her. She answered immediately. Is Caleb okay? Yes. What happened? He wants Lucas's number. Silence. Then a small broken sound. Oh. Don't make it a big deal. I'm not. You are crying. I can cry quietly. Fair. She sent the number. Caleb texted Lucas. I did not read it. Private. The next morning, Caleb told me Lucas had apologized for taking his room. What did you say? That it wasn't his. Good. Then he looked at me. Dad? Yes? Mom didn't mean to hurt me. No. Are you still mad? Yes. He considered that. You can be mad if she didn't mean it. Yes. That might have been the most important thing I taught him that year. Intent does not erase consequence. Love does not erase fear. And forgiveness does not require pretending the decision was acceptable. 3 weeks later, Vivian returned to St. Catherine. Not as director. Not as department chief. Just attending trauma surgeon. Her old office had already been reassigned. Her name was removed from the leadership page. Another surgeon controlled the schedule. For the first time in 7 years, Vivian had to request operating room block changes instead of approving them. She called me after her first shift. How was it? Awful. Bad case? No. Then? Dr. Chen told me no. I almost laughed. To what? I wanted to add a non-urgent case tomorrow. And? There wasn't capacity. So she said no. Yes. And the hospital remained standing? Barely. I smiled. Then Vivian did too. I used to think losing everything would mean losing surgery. And? I still have the part I'm actually trained to do. That was true. She had lost power. Not skill. Then her voice softened. But I may still lose you. I did not answer. Because the family law petition was sitting unsigned on my lawyer's desk. And unlike the hospital committee, there was no panel that could tell me whether Vivian had changed enough to remain my wife. That decision belonged to me. And I was beginning to understand that taking Caleb away from St. Catherine had been the easy part. The harder question was whether I was also going to take him out of the family we had built with her. I did not file for divorce that week. Not because Vivian asked me to stay. She didn't. Not because Caleb asked me to forgive her. He didn't. I waited because something about the entire situation had started bothering me. Everyone wanted to use Caleb to prove something. The hospital used his fear as evidence of harm. Vivian's colleagues used his recovery as evidence that the medical decision had not been dangerous. My lawyer wanted to know whether he preferred living with me. Vivian's attorney wanted to document how often she called him. Even Eric's statement revolved around whose child needed what. And I realized we were one step away from doing exactly what Vivian had done in the ICU. Turning our son into a resource adults allocated according to what outcome they wanted. So I stopped. My family lawyer, Rachel Ford, looked across her desk at me. You understand we have to address parenting. Yes. You cannot tell the court, leave Caleb out of it. I know. He's 13. His preferences may matter. I know. Then what are you asking? That we stop treating every sentence he says like testimony. Rachel leaned back. Fair. What happened? He told me he misses his mother. That's relevant. Yes. He also said he's scared she'll make medical decisions for him again. Also relevant. Yes. And last night he asked whether saying he misses her means he has to move home. Rachel's face changed. There. He thinks the adults are scoring his answers. Yes. That's not good. No. She closed the draft petition. What do you want instead? I had thought about it all night. Temporary agreement. Already have one. Longer. How long? 3 months. And then? Family therapist. For Caleb. For all of us. Rachel nodded slowly. You want to postpone filing? Yes. Daniel, postponing does not fix the marriage. I know. It also gives Vivian time to rebuild a custody argument. That sentence irritated me. She's his mother, not opposing counsel. In court, both can be true. I'm not trying to beat her. Rachel watched me carefully. That is important for me to know. Then she said, what are you trying to do? I looked down at the unsigned petition. Figure out whether the family needs to end before we ask a judge to organize the ending. She did not love that answer. Lawyers prefer defined objectives. So did surgeons. Apparently I had married into the same personality type I hired. But she agreed. The temporary parenting agreement was extended. Caleb stayed primarily with me at Mark's while he recovered. Vivian had dinner with him 3 evenings a week. Alternate weekends once he was medically cleared for normal activity. Healthcare decisions would follow treating physicians. Neither parent would independently redirect treatment without consultation except in an emergency. And one new line. Neither parent shall ask Caleb to express a preference regarding divorce, custody, or parental blame outside a therapeutic setting. Vivian signed it immediately. Then texted, thank you. I almost ignored it. Instead, this is for him. She replied. I know. That was better. The first family therapy session happened in a converted brick house 2 miles from Lakeside. Dr. Nora Ellis specialized in families after medical trauma. Not marriage counseling. Not yet. Her waiting room had no inspirational quotes. I appreciated that. Caleb sat between us on a couch. Vivian on one side. Me on the other. Dr. Ellis began with the worst possible question. What do each of you think happened? I answered first. Vivian tried to move Caleb out of ICU without an independent physician approving it because another critically ill child needed the bed. Vivian nodded. Then. And the other child was connected to someone from my past, which made me personally invested. Good. Caleb stared at the carpet. Dr. Ellis asked him, what do you think happened? He shrugged. Mom thought I was okay enough. That sentence hurt. Vivian's face changed. Then he added. And Dad thought she didn't get to decide that. Yes, I said. Dr. Ellis raised a hand. Not correcting me. Just slowing the room. What scared you most? Caleb answered immediately. Waking up and my monitor being unplugged. Not the bleeding. Not the ambulance. Not surgery. The monitor. Dr. Ellis asked. What did you think it meant? That they were done watching me. Vivian started crying. Caleb saw it and immediately said, Mom, it's okay. Dr. Ellis stopped him. No. He looked startled. You don't have to make your mother feel better because you told the truth. That sentence changed the room. Vivian wiped her face. She's right. Caleb looked uncomfortable. Vivian continued. You're allowed to say something scared you. Even if I didn't mean to scare you. Even if I'm sorry. Even if hearing it hurts me. He looked at her. You're not mad? No. Sad? Yes. He thought about that. Then. Okay. That was the first time I saw him relax around the story. Not because the adults agreed. Because he had been told he was not responsible for protecting us from our own consequences. Dr. Ellis asked another question. Caleb, why did you offer your ICU room? He shrugged. Lucas looked worse. Did you feel like you had a choice? Yes. That surprised me. Vivian too. Dr. Ellis asked. What were the choices? I could say no. And? Then maybe he wouldn't have a room. There it was. Not really a choice. A child choosing between his own safety and another child's imagined danger. Dr. Ellis looked at Vivian. She understood. I shouldn't have put that question in front of you. Caleb frowned. You didn't ask me. No. But I made you know enough that you felt responsible for the answer. He nodded. Then asked. Would Lucas have died? Vivian's face tightened. This was exactly where Surgeon Vivian normally arrived. Probability. Risk. Clinical explanation. This time she said. I don't know. Caleb blinked. You don't? No. Good. We knew he needed intensive care quickly. We also had another temporary option. And another patient moved later. So no one can honestly tell you what would have happened. He looked at me. I nodded. That was the answer. Uncertainty. Not the dramatic version any of us wanted. The sessions continued weekly. And something unexpected happened. Caleb became angry. Not at Vivian first. At me. You keep acting like Mom can't be trusted. We were driving back to Mark's after physical therapy. I don't think that. Yes, you do. I don't trust her to make your medical decisions alone right now. That's the same thing. No. It feels the same. Fair. What do you want me to do? Stop checking everything. I glanced at him. What do I check? When Mom gives me medicine. That's because. You check the bottle. Yes. You ask what time I took it. Yes. You ask if she talked to a doctor every time she says something about my ribs. Yes. He crossed his arms. She's a surgeon. That's part of the problem. No. His voice sharpened. That was one problem. I went quiet. That distinction landed harder than I expected. One problem. Not her entire identity. I had spent weeks trying not to turn Vivian into a villain. Yet fear had made me turn every medical skill she possessed into a threat. Caleb continued. She still knows stuff. Yes. She knows more than you. Definitely. So why do you act like if she says I should use the breathing thing, she's taking over? The incentive spirometer. He was right. Vivian recommending routine pulmonary exercises was not an ICU bed transfer. I had collapsed all medical involvement into one category because the boundary violation scared me. That was not sustainable. Okay. He looked suspicious. Okay, what? You're right. His expression changed. Children are not used to hearing parents say that fast. I still want treating doctors making actual care decisions. Fine. But I don't need to treat every medical sentence from your mother like contraband. He laughed. What's contraband? Never mind. Drug stuff? Please stay 13. That night I called Vivian. Caleb yelled at me. Good. I frowned. You want another try? I mean, he yelled at me last week. About what? Calling Dr. Shah's office after he complained about side pain. You called? I asked if it was expected. Did you tell Caleb? After. I sighed. Vivian. I know. No. She paused. I know now. What did Dr. Ellis say? That I turned concern into action before asking him what he wanted. That sounded familiar. And Caleb? He said sometimes pain can just be pain without creating a committee. I laughed. That's my son. He's definitely yours when sarcastic. Then I told her what he said about me checking everything. Vivian became quiet. He defended me. Don't make it that. She caught herself. Right. Not evidence that Caleb chose her. Just a child wanting both parents to stop overcorrecting. I'm going to back off, I said. From what? Treating your entire medical background like a loaded gun. She laughed once. Then. Thank you. I'm not giving you authority back. I know. Caleb's doctors decide. Yes. But if he asks his mother whether bruised ribs hurt when he sneezes, I'm not calling legal. That seems reasonable. We were finally finding something between unrestricted authority and total exclusion. Boundaries. Actual ones. Then St. Catherine complicated everything. Vivian had been back in surgery for 6 weeks when she received a letter from the state medical board. Not disciplinary action. An inquiry. The hospital was required to report certain privilege restrictions and professional conduct findings. The board requested records. Vivian called me. I knew this could happen. What does it mean? Could mean nothing. Could mean formal investigation. License restriction. Eventually, if they find grounds. Revocation? In theory. I heard fear in her voice. Not leadership fear. This was surgery itself. The part she had said she still had. What are you going to do? Cooperate. Lawyer? Yes. Good. Then she said. They may ask you for a statement. I closed my eyes. Of course. What do you want me to say? She went silent. Then. The truth. That answer mattered. No suggestions? No. No list of things you want clarified? No. Vivian. I mean it. Her voice shook. If your truth ends my license, then I need to know that. I did not like hearing that. You don't want to lose surgery. No. Then don't pretend you're neutral. I'm terrified. Good. Not good that she was terrified. Good that she admitted fear without trying to control me. The board did contact me. Formal written questionnaire. Was I aware Vivian had attempted to transfer Caleb? Yes. Did I believe she intended to harm him? No. Did she represent his transfer as medically safe? Yes. Did another physician reverse it? Yes. Did I observe her exerting professional authority? Yes. Did I believe personal relationships influenced her judgment? Yes. Had she since interfered with Caleb's care? That question took me longer. The honest answer. No. Not after the lakeside conversation and temporary agreement. She had crossed once by informally speaking to Kessler. After Shaw confronted her, she stopped. So I wrote exactly that. No embellishment. No punishment request. No statement about what license she deserved. The board could decide what the facts meant. 2 months later, it did. No suspension. No license revocation. Instead, Vivian entered a consent order. Public reprimand. Completion of an ethics and professional boundaries course. 1 year of practice monitoring focused on conflict disclosure and role boundaries. Mandatory reporting if she treated immediate family outside genuine emergencies. No restriction on routine trauma surgery. No prohibition on operating. No career-ending medical board action. When she called, she was crying. They're letting me keep my license. Yes. I thought. She stopped. What? That losing the directorship was only the beginning. It was the beginning. Just not of everything. No. That distinction mattered. She had lost leadership. Lost standing. Lost part of her income. Picked up a public disciplinary record that would follow credentialing applications for years. But she remained Dr. Vivian Mercer. Surgeon. The medical board did not exist to write satisfying endings. It existed to decide whether she could practice safely under defined conditions. Apparently the answer was yes. That evening, Caleb asked if we could have dinner together. All 3 of us. Not therapy. Not visitation exchange. Dinner. At a pizza place. Vivian looked at me when he asked. She did not answer for both of us. Another tiny change. I said yes. We sat in a booth. Caleb ate enough for 3 people. Vivian complained. I told her trauma surgeons apparently knew nothing about teenage metabolism. For nearly 40 minutes, nobody discussed the ICU. Then Caleb said, "So are you guys getting divorced?" Vivian nearly choked. I put down my glass. We agreed not to make you answer questions about our marriage. I know. That doesn't mean you can't ask. I'm asking. Fair. Vivian looked at me. Not taking control. Waiting. I answered. We don't know yet. Caleb frowned. You've had months. Yes. That's kind of ridiculous. Also fair. Vivian laughed. Your father enjoys uncertainty now. That is slander. Then Caleb became serious. If you do, is it because of me? No. Both of us answered at once. Fast. Certain. His shoulders dropped slightly. Good. Vivian added. What happened in the ICU exposed problems between your dad and me. It did not create them. That was new information. Caleb looked at me. I nodded. We had problems before the accident. Were you going to divorce? No. Then it did create it. 13-year-old logic. Not entirely wrong. I answered carefully. It created a decision we can't avoid anymore. He considered that. Then. Okay. No plea for us to stay together. No tears. Just okay. After dinner, Vivian walked us to my car. Caleb got in. She stood beside me. I got an offer today. What? St. Catherine. Leadership? No. She almost laughed. They asked me to help build a conflict of interest protocol for clinicians treating or making placement decisions involving family. I stared at her. That feels aggressively ironic. I said the same thing. Are you doing it? I don't know. Why not? I'm worried they want to turn me into proof the hospital fixed everything. That was smart. And? I told them I'll contribute clinical input, but I won't chair it. I smiled. What? That sounds reasonable. Careful. I have a reputation. She looked through the car window at Caleb. Then back at me. Daniel, I'm starting to understand something. What? I keep saying I lost the department. The title. The authority. But the worst thing I lost was the assumption that being right medically meant people should trust me automatically. Yes. And now? Now I have to earn trust in smaller pieces. That sounded exhausting. It was also probably the only way back. Not to the directorship. Not necessarily to our marriage. To being someone whose judgment could be respected without everyone surrendering theirs first. I got into the car. Vivian stepped back. Caleb rolled down the window. Mom. Yes? You're coming Saturday, right? She smiled. If you still want me to. He rolled his eyes. I literally just asked. Vivian laughed. I'll be there. As we drove away, I realized something I had not expected. Taking Caleb away had been necessary. Keeping him away forever would not have been. The hospital had already decided what Vivian could still be as a surgeon. The medical board had decided what she could still be as a doctor. Now Caleb was slowly deciding what she could still be as his mother. And unlike every institution that had reviewed her, he was not interested in punishing her. He simply wanted her to stop deciding for him before he had been allowed to speak. The harder question remained mine. Not whether Vivian had lost enough. Not whether she deserved another chance. Whether I could build a marriage with the woman learning to ask. After 16 years with the woman who had always believed knowing the answer gave her the right to choose it, Vivian was offered another department. Not at St. Catherine. 3 states away. That was how I learned how much of her career had existed because nobody ever expected to question her judgment. The call came from Broadwell University Medical Center in North Carolina. Major trauma program. Expanding pediatric services. Their chair of surgery was retiring. They wanted Vivian to interview for chief of trauma and acute care surgery. Not just her old job back. A bigger one. More surgeons. More research funding. More money. A fresh hospital where almost nobody had watched her hand over her badge. She told me after Caleb's Saturday soccer practice. He had been medically cleared for normal activity 2 weeks earlier. Still slower than before the accident. Still nervous whenever somebody hit him near the ribs. But running. Arguing with referees. Being 13. Vivian and I were standing beside the field while he packed his bag. Broadwell called. I looked at her. Broadwell University? Yes. For surgery? Department chief. I stared. You applied? No. Headhunter. Do they know? She knew what I meant. Yes. All of it? She hesitated. There's a standard disclosure process. That was not the answer. Vivian. They know I stepped down from leadership. Why? I told them. Do they know why? They know there was a professional boundary event. I crossed my arms. Do they have the medical board order? Not yet. There it was. Then they don't know. Her jaw tightened. They will before credentialing. After they fly you out, interview you, negotiate compensation, and start imagining you running the department. Yes. That feels familiar. Her face changed. She knew exactly what I meant. Decide enough of the outcome first. Let inconvenient facts arrive later when everyone is already invested. I didn't hide it. You summarized it. That's what the recruiter asked for. And what did you say? She looked toward Caleb. He was talking to another boy. Then. That I lost my St. Catherine leadership role after intervening in an ICU placement involving a family member. That is technically true. Yes. And Lucas? I didn't name a minor patient. Correct. The fact he was Eric's son? No. Your attempt to move Caleb before Shaw approved it? I said there was disagreement over placement authority. I laughed once. Vivian. I know. Do you? Her expression hardened. This is my professional record. I am entitled to explain it accurately without using the most damaging possible phrasing. Yes. That was also true. You don't have to describe yourself as some monster. I'm not. But if Broadwell is considering giving you authority over a trauma department, they need the actual conflict. She looked away. I did not push further. It was not my interview. Not my license. Not my decision. That itself was progress. 2 days later, Vivian flew to North Carolina. Broadwell loved her. Of course they did. She had publications. Strong outcome data. 2 decades in trauma surgery. Experience building a regional referral network. Former department leadership. National conference presentations. A surgeon who could walk into a hemorrhaging patient at 3 in the morning and make a room move faster. The same traits that had gotten her into trouble made her professionally valuable. Certainty. Speed. Authority. Broadwell offered her the position 10 days later. Base salary far above St. Catherine. Leadership stipend. Relocation package. Research support. They wanted an answer within 3 weeks, subject to credentialing. Vivian called me. I got it. Congratulations. Silence. You mean that? Yes. You don't sound excited. It isn't my job. That hurt her. I heard it. Then she said, Caleb could stay here with you. My body went still. There. The sentence arrived too easily. He could. I could fly back twice a month. Yes. School wouldn't change. No. I'm not saying I've decided. I know. She continued faster. I just mean the job doesn't have to affect him. That was when I realized Vivian was still doing something familiar. Not controlling us. Planning around us. Solving the logistics of a family decision before asking the people in the family what it meant. Have you talked to Caleb? No. Why not? I wanted to know whether I was taking it first. Exactly. She went silent. You're deciding the job first, then planning how he fits around it. That's not fair. Isn't it? I lost my leadership role here. Yes. This may be my only chance to lead another major program. Maybe. I've worked 20 years for this. I know. Her voice sharpened. So what do you want me to do? Turn it down because our marriage is uncertain? No. Because Caleb might miss me? No. Then what? Ask him before you build his answer into the plan. Silence. Then. Right. That was all. No fight. She called him that evening. I did not sit in. Caleb told me afterward. Mom got a job. She got an offer. Whatever. What do you think? He shrugged. It's far. Yes. She asked if I'd be mad. What did you say? I said yes. I almost smiled. And? She said okay. Anything else? I asked if she wants it. What did she say? Caleb frowned. She said she wants to be wanted for it. That answer hit me. I had heard versions of it before. Not from Vivian. From people who had spent years at the top of something. Sometimes losing authority makes the next invitation feel like proof you were never really diminished. Maybe Broadwell was not only a job. Maybe it was a verdict. One hospital took leadership away. Another wanted to give it back. Caleb said, "Is that the same as wanting the job?" No. I told her that. I laughed. What did she say? That I sound like you. Poor kid. He rolled his eyes. Then. I don't want her to go. That mattered. Did you tell her? Yes. Did she get upset? She cried. I nodded. Then Caleb surprised me. I also told her she should go if she really wants it. I stared at him. Why? Because I don't want her staying and then acting like it's because of me. 13. Too perceptive. Good answer. I know. The credentialing packet arrived at Broadwell 3 days later. That was when the job began to collapse. Not because St. Catherine blacklisted Vivian. It didn't. Broadwell received the same things every hospital would eventually receive. Medical Board Consent Order. St. Catherine Privilege Action Summary. Leadership Removal Documentation. Professional Boundary Remediation. Then Broadwell asked for the full hospital peer review outcome that Vivian was legally permitted to disclose. She gave it. No edited version. That mattered. 2 days later, their chief medical officer called her. Not the recruiter. The CMO. They wanted clarification on one issue. Why had Vivian told the recruiter only that she intervened in an ICU placement involving a family member, when the actual incident involved both her own son and the child of her former husband. Vivian called me afterward. They think I minimized it. Did you? Yes. Immediate. That surprised me. What did you tell them? That I was trying to describe the event without disclosing protected patient information. That's partly true. Yes. And? I also didn't want to say the sentence. What sentence? She was quiet. Then, I tried to move my son out of intensive care to make room for my ex-husband's son. There it was. The headline version. Brutal. Incomplete. But real enough to hurt. She continued. It sounds like I chose Eric's family over Caleb. You didn't think of it that way. No. But you knew how it would look. Yes. And that made you soften it. Yes. Broadwell did not withdraw the job immediately. Instead, the hospital put leadership appointment on hold and offered Vivian a different possibility. Attending trauma surgeon. No department chief role for at least 2 years. Formal leadership reconsideration after successful practice and professional boundary review. Still excellent pay. Still prestigious hospital. But no immediate authority. Vivian was furious. Not at them. At herself. I did it again. She called me from her car. What? Tried to control the first impression. Yes. I told myself I was protecting patient privacy. You were. And protecting myself. Yes. She hit the steering wheel. I hate that both can be true. Most bad decisions would be easier if they came from one motive. She laughed bitterly. Then. They still want me. As a surgeon. Yes. Do you want that? I don't know. Good. Not because uncertainty was virtuous. Because old Vivian would already be calculating how quickly 2 years could become 18 months. Are you going to take it? I asked for a week. Smart. She did something with that week I did not expect. She went back to St. Catherine and asked Dr. Chen whether she should leave. Not me. Not Eric. Not a recruiter. The surgeon who had replaced her in leadership. Chen apparently laughed. Then told her. If you're leaving because you want Broadwell, go. If you're leaving because you can't tolerate working here without being chief, stay. Vivian told me that over coffee. What did that do to your decision? Made me angry. Usually useful. I asked her what she meant. And? She said I still walk into trauma conference like I'm waiting for everyone to realize the wrong person is running it. I winced. Accurate? Yes. That bad? Yes. Vivian looked exhausted. I thought I was doing well. You are operating. I mean emotionally. That wasn't your specialty. She almost smiled. Then. Maybe I need to learn how to be good somewhere I'm not in charge. That was new. Vivian declined Broadwell. Not because I asked. Not because Caleb demanded it. Not because the job disappeared. It was still available. Attending role. Possible future leadership. She declined because she finally admitted the part she wanted most was the title. The chance to erase what St. Catherine had decided. To become chief again somewhere new and prove the loss had been temporary. She stayed. At St. Catherine. In the department she used to run. Under Dr. Chen. That choice cost her more pride than leaving would have. 3 weeks later, I saw what it looked like. Caleb had his final trauma follow-up. Dr. Kessler at Lakeside cleared him. No activity restrictions. No more scheduled labs. No more routine imaging. He was done. Afterward, Caleb asked. Can Mom come home now? I thought he meant for dinner. What? To the house. We still owned it. Vivian had been staying in a small apartment near the hospital. I had moved from Mark's back into our house with Caleb once he was recovered enough to use stairs comfortably. Why? He shrugged. She's not treating me. No. She's not suspended. No. I'm not scared of her being home. That last sentence mattered. I looked at him. Do you want her back because you think it'll fix us? No. Too fast. Teenager. Then. Maybe a little. Fair. But mostly I miss her. I know. Do you? Yes. He stared at me. Then why can't she come home? Because missing someone and trusting them are not the same. Because I still woke sometimes hearing monitor leads being disconnected. Because every time Vivian sounded certain, a part of me wondered who had been allowed to disagree. Because taking our son out of St. Catherine had been easy compared with deciding whether I could let his mother back into the life where she had once assumed authority. I said. I'll talk to her. That evening, Vivian came over. Not with luggage. For dinner. Caleb disappeared upstairs afterward with suspicious efficiency. Vivian looked toward the ceiling. He planned this. Obviously. She smiled. Then I asked, "Do you want to move home?" Her eyes widened. For the old Vivian, that question would have produced immediate strategy. Terms. Timing. How to tell Caleb. What room she would use. Instead she asked, "Do you want me to?" I asked first. I know. She looked around the kitchen. The house. Our photographs. The place she had not slept in for months. Yes. Her voice cracked. I want to come home more than I wanted Broadwell. That was probably true. Then why didn't you ask? She looked at me. Because I don't know whether wanting access means I should have it. That sentence stopped me. Access. To the house. To Caleb. To me. She finally understood the difference. I said, "Guest room." She froze. What? You can move into the guest room. Hope appeared so fast it scared me. This is not reconciliation. I know. Not yet. I know. Caleb's healthcare boundaries stay exactly as written. Yes. No physician calls unless he asks or it's an emergency. Yes. No checking his chart through colleagues. I haven't. I know. And if this doesn't work, I leave. No argument. No bargaining. She was crying now. I continued. You don't get to tell Caleb this means we're staying married. I won't. You don't get to tell anyone. I won't. Then okay. Vivian moved home Saturday. 1 suitcase. No white coat. No hospital laptop at the dinner table. She stood in the doorway of the guest room like she had been admitted to somewhere she no longer assumed she belonged. Caleb hugged her. Hard. She looked over his shoulder at me. I did not smile. Not because I wanted to punish her. Because I needed the moment to remain exactly what it was. A mother coming home. Not a surgeon reclaiming authority. Not a wife winning forgiveness. Not proof the family had survived. Just one door opening under conditions she had finally learned she did not get to set alone. By then Vivian had lost her department. Her leadership title. Part of her income. Her professional standing. A bigger job she could have used to escape the consequences. And months of living with her own son. But the thing that terrified her most was still sitting in front of her every evening at our dinner table. Me. Because unlike hospitals, boards, and credentialing committees, I had no written remediation plan telling her what she had to do to get her marriage back. And the closer she came to rebuilding everything else, the harder it became to ignore the possibility that I might be the one thing she had changed too late to keep. Vivian lived in the guest room for 43 days before Caleb collapsed at school. That sentence sounds worse than what happened. At 11:26 on a Tuesday morning, I was sitting in a claims meeting when my phone rang. Bayview Middle School. Every parent knows the feeling. Nothing good begins with the school nurse calling in the middle of the day. Mr. Mercer? Yes. This is Allison Grant, the school nurse. Caleb became dizzy during gym and briefly lost consciousness. I stood so fast my chair rolled backward. Is he awake? Yes. Talking? Yes. Hit his head? We don't believe so. His teacher caught him. Blood pressure? There was a pause. Then I realized what I was doing. Trying to become Vivian. He's stable, Nurse Grant said. But given his recent trauma history, we've called EMS. Good. I also called his mother. My stomach tightened. Vivian was closer. St. Catherine sat 6 minutes from the school. My office was almost 25 away. I'm coming. I hung up. Then stopped. The old fear arrived immediately. Vivian would get there first. Vivian would see Caleb. Vivian would hear syncope and become Dr. Mercer. She would start deciding. Calling. Ordering. Redirecting. My hands tightened around the steering wheel before I had even left the parking garage. 43 days. That was how long she had been living under our roof again. 43 days of normal dinners. Separate rooms. Family therapy. No clinical overreach. No secret chart access. No asking Caleb to let her just check anything. She had been almost aggressively careful. Then came an actual emergency. Rules are easy when nothing is happening. This was the test. I called her. She answered immediately. I'm 3 minutes away. What happened? School says he passed out. I know. I'm going there. I know. Silence. Then she said. I'm his mother. I gripped the wheel. Yes. Only his mother. Something in my chest loosened. Okay. I'll call you when I see him. No medical decisions without the treating team. I know. Vivian. I know. Not irritated. Not defensive. Just clear. I won't touch the wheel. That phrase stayed with me. By the time I reached Bayview, the ambulance was still there. Vivian stood beside it. Not inside. That was the first thing I noticed. A paramedic was speaking with Caleb. Another was checking his blood pressure. Vivian had both hands shoved into the pockets of her coat like she physically did not trust herself with them. Caleb saw me. Dad. I went straight to him. You okay? I'm fine. You passed out. For like 2 seconds. Still counts. He rolled his eyes. Good. Teenager behavior. Vivian looked exhausted. Not because of work. Because standing 6 feet away while another medical professional evaluated her son was apparently harder for her than most operations. The paramedic looked at us. Vitals are good now. He says he skipped breakfast and barely drank anything before gym. I looked at Caleb. You skipped breakfast? I wasn't hungry. Vivian opened her mouth. Stopped. Closed it. I almost laughed. The paramedic continued. Glucose is normal. Heart rhythm looks normal on the monitor. Given his recent abdominal trauma and embolization, I'd still recommend emergency department evaluation. Yes, I said. Caleb groaned. Vivian said nothing. The paramedic looked at her. Your mom? Yes. Any preference where we transport? There it was. A simple question. St. Catherine was closest. Lakeside was nearly 2 hours away. Vivian's face changed. She looked at me. Then at Caleb. Then back to the paramedic. Ask his father. I hated that answer. Not because she was trying to control anything. Because she was overcorrecting. I said. No. Everyone looked at me. You're also his parent. Vivian froze. That doesn't mean you disappear from decisions. Her eyes filled. The paramedic wisely stared at his tablet. I continued. Closest appropriate hospital? St. Catherine. I looked at Caleb. You okay going there? He hesitated. That mattered. Then. Yeah. Vivian asked quietly. You sure? Yes. Then St. Catherine. No doctor language. No special call ahead. No surgeon network. Just parents agreeing to the nearest appropriate emergency department. I rode with Caleb. Vivian drove. At St. Catherine, the emergency physician was a young woman named Dr. Patel. She recognized Vivian immediately. Dr. Mercer. Vivian shook her head. Please don't. Patel looked confused. I'm his mother. That was it. No explanation. No credential flex. Patel nodded. Then began evaluating Caleb. Blood work. ECG. Ultrasound because of his history. Orthostatic vitals. Everything looked reassuring. Dehydration. Not recurrent bleeding. Not cardiac disease. Not some delayed catastrophic complication from the crash. He had skipped breakfast, barely drunk water, and run sprints in a hot gym. 4 hours later, we went home. The most medically boring emergency possible. I had never been happier. That evening Caleb ate 2 cheeseburgers and half a container of fries. Vivian watched him. Then finally said, You know water exists. He rolled his eyes. Yes, Mom. You're allowed to drink it before losing consciousness. Doctor's orders? The room stopped. Caleb realized it too. Then Vivian smiled. No. Mother's nagging. Much more serious. He laughed. So did I. That should have been a happy ending to the test. Instead, later that night, I found Vivian crying in the laundry room. Not the bedroom. Not somewhere she expected me to see. She sat on the floor beside the dryer with a towel in her lap. Hey. She wiped her face. I'm fine. Clearly. I sat beside her. For a minute neither of us spoke. Then she said, Do you know how many times today I knew what they should do? Probably all of them. Not all. Most. She laughed weakly. When the paramedic asked where to take him, I wanted to say St. Catherine immediately. Reasonable. I didn't. I noticed. When Patel ordered the ultrasound, I knew why. Also reasonable. I wanted to explain his embolization. You could have. She looked at me. Could I? That question mattered. Yes. She seemed surprised. I don't need you to pretend you know nothing. That's what I've been doing. I know. Because every time I know something, I'm afraid you'll think I'm taking over. I do sometimes. Her face fell. I continued. That doesn't mean you have to become medically stupid. She laughed through tears. Thank you. There's a difference between information and authority. She looked at me. That was the exact distinction our family had been trying to build for months. You can tell a Dr. Caleb had a splenic embolization. Yes. You can tell him what medicines he takes. Yes. You can ask questions. Yes. You can even disagree. Her expression changed. But I don't get to decide. Not alone. She nodded. Right. Then she whispered. I don't know how to be his mother without also knowing too much. That was probably the first truly difficult thing she had faced after the ICU. Not learning when to stop being a surgeon. Learning that she did not have to amputate the surgeon part of herself completely. Boundaries were not disappearance. They were limits. The same week, St. Catherine announced a new ICU placement policy. No employee involved in bed allocation could personally participate in placement decisions involving an immediate family member, former spouse, current partner, or any patient with a significant close personal relationship. A neutral attending and nursing supervisor had to approve. Emergency exceptions were documented afterward. It was not called the Mercer policy. Thank God. Vivian had helped review it but refused to appear in the hospital announcement. I don't want to be the redemption mascot. Good. They wanted me on a staff video. Absolutely not. That's what I said. You used those exact words? No. Coward. She smiled. For the first time in months, our home began to feel almost normal. That was dangerous. Normality can hide unanswered questions. Vivian cooked again. Badly. Caleb complained again. Loudly. We watched movies. Argued about thermostat settings. She slept in the guest room. Sometimes I heard her walking past our old bedroom at night. Sometimes I almost asked her in. I never did. Then came our 17th wedding anniversary. Neither of us mentioned it that morning. By evening, Caleb had. Are we doing anything? Vivian and I looked at each other. No, I said. He frowned. But it's your anniversary. We know. That's weird. Vivian smiled faintly. Lots of things are weird right now. He looked between us. Are you getting divorced? Again. The question had changed. Earlier it came with fear. Now frustration. He wanted an answer. So did I. Family therapy had stabilized Caleb. He was back at school full-time. Back in soccer. No more nightmares about monitors being removed. He spent time alone with Vivian without asking whether I would be nearby. Our temporary parenting agreement had done what it needed to do. The medical crisis was ending. Which meant I could no longer use Caleb's recovery as a reason not to decide my marriage. That night, Vivian placed a folder on the kitchen table. I recognized the logo. Family law firm. My stomach tightened. You filed? No. She sat across from me. I had papers drafted. I stared. Why? Because I think you're waiting for me to make the decision again. That stopped me. She continued. And I don't want to. Then why papers? So you don't have to be the person who does all the administrative work if your answer is divorce. That was unexpectedly practical. Very Vivian. I'm not asking you to sign tonight. Okay. I'm not asking you to stay. Okay. I just think we need to stop telling Caleb we don't know because we're afraid to know. She was right. I hated that. What do you want? She looked at me for a long time. The marriage. Immediate. But? I don't think wanting it means I should get it. That sentence would have been impossible 6 months earlier. She continued. I want to move back into our room. I want to wake up next to you. I want to go to Caleb's games together. I want to complain about your coffee. You already do. That part survived. I smiled despite myself. Then she became serious. But I know the version of our marriage I want back is the one where you trusted my judgment almost automatically. Yes. And that version should not come back. There it was. The real problem. Could we build a second marriage without recreating the first? I opened the folder. Draft petition. Property division outline. Parenting proposal. Joint legal custody. Shared parenting schedule. Healthcare decisions by mutual agreement, guided by independent treating physicians. No attempt to minimize my role. No request for special medical authority. No ambush. At the bottom of the proposed parenting plan, one sentence caught me. Neither parent's professional expertise shall create unilateral decision-making authority over the other parent in matters concerning Caleb. I looked at Vivian. You put that in? Yes. Your lawyer? I asked for it. Why? Because if we divorce, I don't want you spending the next 5 years wondering whether a judge thinks surgeon means I win every medical disagreement. That was smart. Painful. Responsible. I closed the folder. We're not signing tonight. I know. Then I asked, would you leave St. Catherine? Her eyes widened. For us? Yes. She thought. A few months earlier, she might have said yes immediately. Whatever saves the marriage. Instead, no. That surprised me. Why? Because leaving would turn the hospital into the villain. I waited. I made the decision. St. Catherine punished it. They also let me keep doing the part of medicine I'm good at. She looked toward the hallway where Caleb's bedroom door was closed. And if I leave just to prove I choose you and Caleb, then I'm turning another career decision into a loyalty test. That was exactly right. I felt something inside me shift. Not forgiveness. Respect. New respect. Smaller. Harder earned. More valuable. 2 days later, Dr. Chen called Vivian into her former office. The room no longer belonged to her. That detail still hurt. Chen offered her a new role. Not leadership. Senior trauma surgeon. Same clinical privileges. More complex operative cases. Teaching responsibilities with residents. No personnel authority. No departmental budget. No bed allocation control. A job built around what Vivian still did exceptionally well. Operate. Teach. Think. Without making her the person who owned every decision around her. She accepted. Her pay stayed lower than before. Her title stayed smaller. Her office stayed smaller. Her medical board reprimand remained public. Nothing magically returned. When she told me, she was smiling. You're happy? Yes. About not being chief? She thought. I'm happy I don't need to be chief to know I'm still good. That was different. Then she added. Apparently losing everything was exaggerated. By whom? Everyone. I looked at her. She had lost a lot. The directorship. Authority. Prestige. Income. Broadwell leadership. Months under the same roof as her son. My automatic trust. But she had not lost everything. Not yet. The thing she feared losing most was still undecided. Me. 1 month later, the answer finally came. Not after a medical emergency. Not after therapy. Not after an argument. After a normal Tuesday dinner. Caleb went upstairs. Vivian began loading the dishwasher. I watched her ask. Is this yours? Holding my coffee mug. A stupid question. She knew it was mine. Then I realized why she asked. Months of retraining herself. Mine. Yours. His. Not automatically hers to move, decide, use, or correct. That tiny habit had spread everywhere. She asked before using my truck. Asked before changing plans involving Caleb. Asked whether I wanted advice before giving medical opinions about my ribs. Sometimes it was almost ridiculous. But it was real. I walked over. Vivian. She turned. What? Move back into our room. She froze. The plate in her hand stopped halfway to the dishwasher. What? You heard me. Tears appeared instantly. Daniel, don't say that because today was good. I'm not. Or because Caleb wants it. I'm not. Or because you think I've lost enough. I don't. Her face changed. That one mattered. This was not a reward after sufficient punishment. I continued. I don't trust you the way I did before. She nodded. I probably never will. Another nod. But maybe that isn't entirely bad. She stared at me. I trusted you without checking whether the decision was actually yours. Yes. You assumed I'd follow because usually I did. Yes. That marriage is over. She started crying harder. Then I said. I'm willing to see if another one can exist. Her hand covered her mouth. Not forgiveness. Not reset. A new agreement. Built around the thing Vivian had failed to understand in room 8. Being the most capable person in a room does not make every choice yours. She put the plate down. Then asked. Can I hug you? I laughed. Actually laughed. You're taking this asking thing too far. Answer the question. Yes. She hugged me. For the first time since the ICU, I hugged her back without wondering whether I was surrendering something. Caleb came downstairs because apparently 13-year-olds have supernatural timing. He saw us. Stopped. Oh, gross. Vivian laughed into my shoulder. I looked at him. Your mother's moving out of the guest room. His face lit up. Then he immediately tried to hide it. Cool. Very convincing. Whatever. He went back upstairs. Vivian did not move into our room that night. She waited until Saturday. Because she wanted us to tell Dr. Ellis first. I mocked her for this. She ignored me. That was probably healthy too. The draft divorce papers stayed in the kitchen drawer. Unsigned. Not destroyed. I insisted on that. Not as a threat. As a reminder. We were choosing this. Choice only matters when there is another real option. Vivian had spent months learning that lesson professionally. Now she would have to live it at home. And if she wanted to keep what remained of our family, there could never again be a moment when being wife, mother, or surgeon allowed her to decide that Caleb, or I, was the person safest to sacrifice because she believed we would survive the loss. 3 months after Vivian moved back into our bedroom, Lucas Dalton's mother sued St. Catherine. Not Vivian. Not me. Not Caleb. The hospital. Her name was Natalie Dalton. Eric's second wife. Lucas's mother. I had met her only once before, at a charity dinner years earlier. She filed the lawsuit after Lucas developed a complication from his liver injury that required 2 additional procedures and another hospitalization. The complaint alleged that St. Catherine had delayed placing him in the pediatric ICU after his transfer from County North. According to Natalie's attorneys, the delay contributed to unstable blood pressure, prolonged ventilation, and kidney injury. Whether that was medically true was another question. But the timeline was real. Lucas arrived. No PICU bed was immediately available. He spent 27 minutes in recovery under temporary ICU-level staffing before another patient was safely downgraded. Then he moved into room 8. Caleb's room. The lawsuit dragged our family back into the exact night we had spent months trying to leave behind. Vivian found out before I did. She came home carrying a legal envelope. Caleb was upstairs. She put it on the kitchen counter. I've been subpoenaed. I stared at her. For Lucas? Yes. As a witness? Yes. Defendant? No. That mattered. St. Catherine's lawyers wanted her testimony because she had been involved in the transfer discussion before Lucas arrived. Natalie's lawyers wanted it for the same reason. Only they wanted something different from Vivian. They wanted her original judgment. The one she had spent nearly a year admitting she should never have made. Vivian sat at the table. They're going to ask whether Caleb could have safely moved. He could have, eventually. That's not the same question. No. She looked at me. They'll ask whether moving him at 217 would have gotten Lucas into intensive care sooner. Yes. It would have. Probably. That was the uncomfortable truth. If I reduced the entire story to minutes, Vivian's decision might have benefited Lucas. Move Caleb immediately. Open room 8. Lucas goes directly upstairs. No recovery overflow. No 27-minute bridge. That did not make the decision proper. But lawyers love timelines because timelines look cleaner than ethics. Vivian rubbed her forehead. Hospital counsel called. What do they want? They say I should answer narrowly. Meaning? If asked whether Caleb was medically capable of transfer, say that he met several clinical criteria for step-down and probably could have tolerated it. That's true. Yes. What's the problem? She looked at me. They don't want me volunteering the conflict unless I'm asked. There it was. Would that be dishonest? Not technically. Do you want to do it? No. Immediate. Good. Then. But I also don't want to hand Natalie's lawyer a speech about everything St. Catherine did wrong. Also fair. She sighed. I hate depositions. You perform surgery. Bodies are easier. I believed her. A week later, Vivian sat for deposition. Her lawyer was there. Hospital counsel. Natalie's attorneys. Eric attended part of it. I did not. I had no role. That itself mattered. A year earlier, I would have wanted every transcript. Every email. Every sentence involving Caleb. Now I waited for Vivian to come home. She arrived after 8. Dropped her bag. Walked directly into the kitchen. How bad? I asked. Would you like the legal answer or human answer? Human. Awful. I poured her water. She drank half the glass. Then said, they asked the question. Which one? If I still believed moving Caleb was medically reasonable. My chest tightened. What did you say? Yes. I stared at her. She saw my face. Let me finish. I waited. I said that based on the information available at approximately 2 a.m., Caleb might have been clinically capable of step-down care. That hurt to hear even now. Then. And I said I was not the appropriate physician to make that determination. Good. I said his intensivist had not completed the downgrade. Good. I said my personal relationship to both children created a conflict that should have removed me from the allocation decision entirely. Better. She sat down. Natalie's lawyer asked whether my conflict changed Caleb's physiology. I almost laughed. Of course. I said no. Then? He asked whether 27 minutes mattered to Lucas. What did you say? I don't know. That was the correct answer. No surgeon likes saying it. Vivian especially. He pushed. Of course. He asked whether earlier ICU admission is generally preferable for an unstable postoperative pediatric trauma patient. Yes. I said yes. And? Then he asked whether the delay could have contributed to Lucas's kidney injury. I watched her. What did you say? That there were too many variables for me to give a reliable causation opinion. She looked exhausted. I wasn't his treating surgeon. Dr. Chen was. Yes. Did they ask about Caleb's deterioration later? Her face changed. Yes. I sat across from her. What did they do with it? Natalie's lawyer tried to use it both ways. First, if Caleb deteriorated only hours later, didn't that show his condition had been more fragile than Vivian represented? Vivian answered yes. Potentially. Then, if Vivian had succeeded in moving him, could that have created risk to Caleb? Again. Yes. Potentially. Then the lawyer asked. So Dr. Mercer, you chose to expose your own son to increased risk in order to reduce risk to Mr. Dalton's son? I felt anger before Vivian even finished quoting it. What did you say? She looked at me. No. Good. I said I made a flawed allocation decision while believing both children could receive safe care. Also good. I said I did not consciously choose to endanger Caleb. True. And I said the reason the decision was unacceptable wasn't that I secretly wanted Lucas to matter more. She swallowed. It was that I should never have been the person balancing their risks. Exactly. Then Vivian went quiet. What? There was one more question. I waited. Natalie's lawyer asked whether I would make the same decision again if the hospital had no other option. That was a harder question than it sounded. Because remove Eric. Remove marriage. Remove conflict. Imagine 2 children. One stable enough to potentially step down. One critically ill needing ICU. Hospitals make those decisions. Sometimes somebody moves. Resource allocation is real. Vivian said. I told him that if I were the neutral physician responsible for the decision, with complete information and proper authority, I might transfer the more stable patient. I nodded. But if either child were mine? She looked at me. I would recuse myself. There it was. Not. I would always keep Caleb's bed. Not. I would always choose my son. That would have been another kind of unethical certainty. She finally understood the point was not picking the correct favorite. It was knowing when the decision was not hers. What did hospital counsel think? They hated how much I said. Of course. Then afterward, their attorney told me something strange. What? He said my testimony may actually help them. I frowned. How? Because Vivian had described a functioning emergency overflow pathway. Lucas had not been left without intensive care. He had received one-to-one nursing, continuous monitoring, respiratory support, critical care physician involvement. The 27-minute delay was a location issue more than an absence of care issue. And Dr. Chen's records showed that Lucas's kidney injury was already developing before transfer. Natalie still had a case to argue. But it was not the clean story the complaint suggested. Again, reality refused to give anyone a perfect villain. The lawsuit eventually settled. No trial. No admission of malpractice. St. Catherine agreed to a confidential payment to Lucas's family and to cover certain future medical monitoring related to his injuries. The hospital did not settle because Vivian had been right. It's settled because litigation risk is not the same thing as moral truth. Natalie and Eric accepted. Lucas continued recovering. Then came the part that surprised me. Natalie asked if Caleb wanted to meet him. Not through Vivian. Through me. She sent an email. Lucas carries guilt about what happened with the ICU room. He knows Caleb did nothing wrong, but I think hearing that from Caleb may matter. Only if your son wants it. I showed Caleb. He shrugged. Sure. You don't have to. I know. You're not responsible for making him feel better. I know. Dr. Ellis would be proud. Dad. Sorry. We met at a park. Neutral. No hospital. No monitors. Lucas looked smaller than I remembered. He still had a healing scar. Caleb had his own. They stood awkwardly for approximately 12 seconds. Then Lucas said, "Sorry about your ICU room." Caleb rolled his eyes. "Dude, stop." Lucas blinked. "My mom says." "Your mom wasn't in my room." I nearly laughed. Neither boy wanted the burden adults had built for them. Lucas asked, "Were you mad at me?" "No." "Really? Really?" Then Caleb added, "I would have moved if the doctor said I could." That sentence made Vivian flinch. She was standing several yards away beside Natalie. I watched her. She did not intervene. "Good." Lucas asked, "But your mom tried." Caleb shrugged. "Yeah. Are you mad at her?" Caleb glanced toward Vivian. "A little." She heard it. I knew she did. She stayed where she was. No tears. No need for him to rescue her. Then Caleb said, "She's still my mom." That was it. Simple. Not acquittal. Not condemnation. Kids are sometimes better at holding two truths than adults. The boys walked toward the basketball court. Within 10 minutes, they were arguing about whether one of them had traveled. That was probably the healthiest ending available. Natalie stood beside me. I blamed Vivian for a while. I understand. I thought if she'd just moved Caleb, Lucas would have avoided everything. Maybe. She looked surprised. You think so? I think maybe is the only honest answer. She nodded. Eric said the same. That surprised me more. Then she said, "Vivian told me she was sorry." When? Last week. I looked toward my wife. For the complication? No. For making me believe she could guarantee a bed. There it was. Another consequence I had not considered. Vivian's certainty had affected Eric too. He called because he believed she could make room. She told him she could. That promise increased his expectations. When Lucas did not immediately reach ICU, the gap between promise and reality became part of the family's anger. Vivian had not only overstepped inside the hospital. She had promised outcomes that no single physician controlled. Natalie continued. She said something strange. What? She said, I was too accustomed to people treating my confidence like capacity. I almost smiled. That sounded like Vivian. Later, on the drive home, Caleb asked, "Is Lucas going to sue Mom?" No. Good. He never was. Also good. Then, is Mom still in trouble? I looked in the rearview mirror. Vivian sat beside him. She answered before I did. Some consequences don't expire. Caleb frowned. What does that mean? My medical board reprimand stays on my record. My old department is still not mine. I make less money. I have monitoring for a while longer. And some hospitals may never want me in leadership again. Caleb looked horrified. Forever? Maybe. Then he asked, "Does that bother you?" Vivian thought. Yes. Good. No fake enlightenment. She missed what she lost. Sometimes consequences hurt forever precisely because you still value the thing. Caleb asked, "Do you want to be chief again?" Vivian looked out the window. Someday? Yes. That surprised me. She continued. But not because I need to prove St. Catherine was wrong. Why then? Because I was good at parts of it. That was also true. And bad at one part? I asked. She looked at me. The part where I thought responsibility meant ownership. Better. That evening, after Caleb went upstairs, Vivian stood beside me in the kitchen. We need to talk about the divorce papers. I stiffened. They were still in the drawer. Unsigned. Okay. She opened it. Took them out. Put them on the counter. I don't want them sitting here as a threat. I never meant them that way. I know. But every bad week, I look at the drawer. So did I. Choice only works when alternatives are real. But maybe keeping paperwork within arm's reach was no longer choice. Maybe it was permanent emergency planning. A fire extinguisher for the marriage. What do you want to do? She looked at me. Destroy them. Old Vivian would have done it before asking. Now she waited. I thought about it. Then shook my head. No. Her face fell. I took the papers. Not destroy. What then? File them away. Where? With the other records. She stared. Why? Because what happened happened. The hospital reports existed. Medical board order existed. Caleb's transfer existed. Our almost divorce existed too. I did not want healing to require pretending we had never reached that point. She understood. Okay. I put the folder in the locked cabinet in my office. Not the kitchen drawer. Not something we checked after every disagreement. History. Not leverage. When I came back, Vivian was still standing there. She asked, "Are we okay?" I considered the question. Then, "Today?" She smiled. "Today. Yes." That was enough. By then, Vivian had lost almost everything she once assumed defined her. Her directorship. Her leadership office. Part of her income. Broadwell's chief position. Her clean professional record. Months with Caleb. My automatic trust. The belief that Eric could call and she could rearrange an institution for him. The belief that being the most knowledgeable person meant being the rightful decision-maker. But she had not lost surgery. She had not lost motherhood. And she had not lost me. Not because the consequences were too soft. Because everything turned out to include things no hospital committee had the authority to take. Only we did. The final question was whether we could keep them without rebuilding the same family that had once taught Vivian she could decide for all of us. And that answer would come from a place none of us expected. Not another hospital. Not another hearing. Not another lawsuit. From Caleb himself. Caleb chose the hospital. That was the part none of us expected. A year after the crash, Lakeside Children's invited him to speak at a patient safety workshop. Not as a victim. Not as evidence against Vivian. As a former pediatric patient. The workshop brought together nurses, physicians, administrators, and families to discuss how hospitals should involve children in decisions when resources were limited. Dr. Ellis had been asked to recommend a teenage participant. Caleb said yes before either of us could overthink it. Vivian looked at him across the dinner table. You don't have to do this. I know. You don't owe the hospital anything. I know. You also don't have to talk about me. I know. I nearly laughed. A year earlier, Vivian would have given 6 more instructions. Now she stopped at 3. Progress. The workshop was on a Saturday. Parents could attend. Caleb asked both of us to come. Vivian almost said no. I could see why. She had rebuilt enough of her career that walking into a room full of patient safety people to hear her son describe the worst professional decision she had ever made sounded like a special kind of torture. Still, she came. We sat in the back. Together. Caleb sat on a panel with 2 other teenagers and a pediatric nurse. No suit. No rehearsed speech. Just jeans, sneakers, and the kind of posture that made every adult in the room aware he would rather be somewhere else. The moderator asked, "What do you remember most about being in intensive care?" Caleb said, "The monitor." Vivian's hand tightened around mine. He continued, "I remember waking up and somebody was unplugging it. No accusation. Just fact. I thought that meant they decided I didn't need watching anymore." The moderator asked, "Did anyone explain what was happening?" "Yes. My mom said another kid was really sick." "And what did you think?" Caleb shrugged. "I thought I should move." There it was. The sentence from therapy. The moderator asked, "Did you want to move?" Caleb thought. "I wanted the other kid to be okay. That's different." "Yes." The room went quiet. Then he said, "I think adults hear kids say yes and think that means the kid understood the choice." I looked at Vivian. She was crying silently. Caleb continued, "I knew another kid needed a room. I did not know my blood count had dropped. I didn't know my oxygen had gone low while I was asleep. I didn't know there was another way to make room. So when I said yes, I wasn't really choosing between 2 medical plans. I was choosing between being selfish or helping a kid I could see was sicker than me." That sentence hit harder than any committee finding. Because it explained what Vivian's clinical reasoning had missed. Information imbalance. A 13-year-old cannot give meaningful consent to sacrifice a medical resource when the only facts he understands are. Another child looks worse. Adults are waiting. My mother is asking. The moderator asked. What would you want doctors to do differently? Caleb answered. Don't make the kids solve the bed problem. Simple. Then, tell them what's happening. Let them ask questions. But somebody else should decide if moving is safe. The nurse beside him nodded. The moderator asked. Do you blame your mother? The question was not on the planned list. I knew that because Dr. Ellis visibly shifted in her chair. Caleb did not. He looked toward the back. At Vivian. Then me. No. Vivian's breath caught. Then Caleb added. I was mad at her. There it was. Not absolution. And sometimes I still am. Vivian nodded. Barely. But blame is weird. The moderator smiled. How? Because Mom did something wrong. Yes. But she wasn't trying to hurt me. Yes. And Lucas really did need help. Yes. And Dad was right to stop the transfer. I swallowed. But Dad got weird afterward too. The room laughed. I did not. What did your father do? Caleb looked delighted to expose me. He checked everything. Medicine bottles. Doctor calls. Whether Mom said something because she was my mom or because she was a surgeon. More laughter. Fair. And did that bother you? Yes. Because then I felt like if I trusted Mom, I was taking her side. That hurt. I had thought I was protecting him. Somewhere along the way, protection had created another loyalty test. Different method. Same burden. The moderator asked. What helped most? Caleb did not hesitate. When they stopped asking me what I wanted them to do about each other. That sentence ended the room. Not the transfer. Not the medical board. Not Vivian's career. Us. He had not needed to decide whether his mother deserved forgiveness. Or whether his father was right to leave. Or whether we should stay married. He needed to recover without becoming judge. I squeezed Vivian's hand. She squeezed back. After the panel, several physicians approached Caleb. Not us. Good. One intensivist asked permission to use his phrase in training. Don't make the kids solve the bed problem. Caleb said yes. Then demanded royalties. Definitely my son. Vivian waited until the room had mostly cleared before approaching him. You were good. He shrugged. You cried. No. Mom. Professional eye irritation. Sure. Then he looked at both of us. Can we go eat? That was it. No emotional family scene. A teenager had just publicly described the event that nearly split his family and now wanted burgers. Probably healthy. On the drive home, Vivian was quiet. Then she said. He was right about you. I looked over. Dangerous opening. You did get weird. I know. You were scared. Yes. And you turned fear into control. That sounded familiar. I nodded. Yes. She looked out the window. I think that's why I stopped being angry at you for transferring him. Stopped? Mostly. Generous. I used to think if you had trusted me more, you would have kept him at St. Catherine. And now? I think trust was exactly what I had already spent. That was the line. Not lost. Spent. Trust had not vanished because one event magically destroyed 16 years. Vivian had used too much of it in one decision. Then expected the account to remain full because her intention was good. It didn't work that way. Neither did marriage. Months passed. Caleb turned 15. Lucas recovered enough to return to baseball. The boys remained occasional friends, mostly through online games and arguments about sports. Eric and I never became friends. We also stopped being enemies in the way only two men connected by the same impossible night can. Vivian's medical board monitoring ended. No further findings. St. Catherine removed her case review requirement at the scheduled 1-year mark. Not early. No favor. She remained senior trauma surgeon. Dr. Chen stayed department director. Vivian never asked for the job back. Then, 2 years after the ICU incident, Chen announced she was leaving for an academic position. St. Catherine opened a national search for a new director of acute care surgery. Vivian's name came up immediately. Not from her. From other physicians. That created the final temptation. The hospital's CEO asked if she wanted to apply. She came home with the email printed out. I looked at it. You want it? Yes. No hesitation. Why? Because I still think I can lead. Good answer. And? I miss it. Also honest. And? She smiled. You really enjoy making me suffer. A little. She thought longer. Because I think I could do it differently now. That was the dangerous answer. Not wrong. Dangerous because leadership roles should not exist to prove personal growth. I asked. If they choose somebody else? I'll be disappointed. And? I'll still operate Monday. Better. If they ask about the incident? I'll answer. All of it? Yes. No recruiter summary? She glared at me. I deserved that. You did. She applied. The search committee interviewed her. Then 5 external candidates. The hospital's patient safety officer sat on the committee. So did a nursing representative. Those positions had been added after several institutional reviews, not only Vivian's case. The process took 3 months. She made the final 2. Then St. Catherine chose the other candidate, Dr. Samuel Ortiz, 48. Trauma surgeon from Chicago. Strong academic background. No local baggage. Vivian came home after the call and sat at the kitchen table. They picked Ortiz. I waited. You okay? No. Good. She cried. Got angry. Called the process conservative. Said they would regret losing institutional knowledge. Then stopped herself. I'm doing it. What? Turning disappointment into evidence they're wrong. Yes. She took a breath. Maybe Ortiz was better. Maybe. I hate maybe. I know. 2 weeks later, Ortiz started. Vivian attended his first department meeting. He changed her trauma rotation. She disliked it. He rejected one of her proposals. She disliked that too. Then he approved another. Life continued. That was the real test. Not whether Vivian could lose leadership once under punishment. Whether she could lose it again under ordinary competition and remain professionally intact. She did. 3 years later, she became director of surgical education instead. Smaller budget. Less operational control. More teaching. Residents loved her. Mostly because she was brutally good at explaining mistakes. She told them about mine. Not Caleb's case specifically. Patient confidentiality mattered. But she taught a session on conflicts in scarce resource decisions. One slide contained a single sentence. Expertise does not eliminate conflict. Sometimes it makes conflict harder to recognize. That became her favorite line. Our marriage survived too. Not perfectly. We fought. Once about Caleb driving. Once about money. Once because Vivian gave me medical advice after I explicitly said I did not want it. She apologized. I still stayed angry for 2 days. No committee intervened. No lawyer drafted anything. No one moved out. Trust returned differently. Not automatic. Specific. I trusted her as a surgeon. I trusted her as Caleb's mother. I trusted that if those 2 roles collided again, she would stop. She trusted me not to turn one old mistake into permanent veto power. That part took work too. Losing everything never happened the way people later described it. Vivian did not lose her license. Did not lose her son. Did not become unemployable. Did not end up abandoned in an empty mansion. Reality was harder. She lost the department she had spent years building. Lost income. Lost prestige. Lost a bigger job because she tried to soften the truth. Lost my trust almost completely. Lost months of ordinary life with Caleb. And lost forever the version of herself who believed being the best doctor in the room meant she should have the final say. Those losses were enough. 5 years after the crash, Caleb graduated high school. Vivian and I sat together in the bleachers. Still married. Lucas came too. He and Caleb had ended up at the same state university. Different majors. Same dorm complex. Life has a strange sense of humor. After graduation, Caleb found us outside the gym. Cap and gown crooked. He hugged Vivian first. Then me. I complained. He said she cried more. Fair. Before leaving with friends, he handed Vivian a folded piece of paper. What's this? She asked. Open it later. He ran. Vivian unfolded it anyway. Of course. It was a copy of the patient safety workshop quote, printed beneath a photograph of 13-year-old Caleb sitting on that panel. Don't make the kids solve the bed problem. Below it, he had written by hand. You didn't lose me. You just had to learn I was never yours to move. Love you, Mom. Vivian covered her mouth. Then cried hard enough that strangers stared. I put an arm around her. She leaned into me. Years earlier, in room 8, my wife had looked at our injured son and seen the safest bed to free. A stable child. Her child. A resource she believed she understood well enough to move. That decision cost her more than she imagined. But the deepest lesson was not about ICU beds. It was about people. Caleb was not hers to allocate. I was not hers to persuade through professional authority. Lucas was not hers to save by bypassing everyone else. A hospital was not hers to rearrange because she was certain. And love was not proof that the people closest to her should absorb whatever risk she believed they could survive. The night she tried to move Caleb, I thought taking him away would leave Vivian with nothing. I was wrong. What she lost was everything she had confused with ownership. What remained had to be given back freely. Her son's trust. My marriage. Her colleagues' respect. Patients' confidence. None of those belonged to her because she was a surgeon. She had to earn them. And years later, sitting beside her at our son's graduation, I finally understood why that was better than getting everything back. Because anything freely returned can also be freely refused. That is what makes trust real. Vivian read Caleb's note again. Then looked at me. You think he'd let me frame this? He'll charge royalties. Worth it. She folded the paper carefully. This time, she did not decide where it would go. She asked him later. And when our son said yes. Only then did she hang it on the wall. That's all for today. Remember to subscribe and support us.